Awesome. Thank you so very much. Welcome, 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 everyone. My name is Tori Cooper, and I'm the Director of Community Engagement for HRC and our Transgender Justice Initiative. So I would like to thank each and every one of you for taking some time out of your busy Saturdays to join us for what I hope and anticipate is the first of many in our new TransTalks series. Today, we're going to talk about National Transgender HIV Testing Day. And it's going to be an amazing conversation. We are going to be here together for a decent amount of time. And before even you see all of these beautiful faces behind you, we're going to give each of them an opportunity to tell you who they are and what they're about and some of the work that each of them are doing in their own community. And then we're just going to talk like family. And you know, family doesn't always get along, but we're going to talk even better than family today. So again, please feel welcome. Questions, you feel free at any time. We have both Dimitri and Keo, who I totally adore. They both work here at the Human Rights Campaign as well, and they'll be taking notes and writing down some of the questions to ensure that we get them correct. We'll have a question and answer period. Depending on how great the conversation is going, we're anticipating about an hour from now. If folks want to talk a little bit longer, we'll do that and cut the Q&A. We're going to see how it goes. But again, I want to thank each and every one of you, and let's get the show on the road. So advance the next slide, please. So welcome to our first talk, our first of many, again, hopefully many trans talks. My name is Tori Cooper. My pronouns are she, her, and hers. If you will go to the next slide. So these are some of a short list of the programs that we're working under new HRC's new Transgender Justice Initiative, or as you will hear me say, the TJI. So the TJI was created through our new president, Alfonzo David, who started last year. When he came on board as the president of HRC, he made a commitment to the transgender community that he was going to work to promote change from the inside out. And so some of the new initiatives that we're planning for 2020 and beyond, including we're creating an electronic newsletter. That's still in the early phases, but we hope to get out something certainly within the next 2 months. And the newsletter is going to be a way for not only for HRC to communicate with community, but also it'll be a great opportunity for every person of trans experience or non-binary experience, two-spirit experience, to contribute to our newsletter, reach out to communities and people that you may not have a relationship with, but we hope to create growing relationships with. HRC is old white money. That's what it is. We are one of the most, we've been around for 40 years and have a very, very long history of advocating. We are the largest LGBTQ organization in the world, one of the most culturally competent places that you will ever experience, and also historically one of the whitest places that you've ever worked. And I mean that with love and reverence. But what we're going to do is we are being very, very intentional about reaching out to communities and folks for whom LGBTQ issues have not prioritized for a long, long time. So the newsletter will be a great way for each of us to take a part and have our voices and our communities heard. Our justice and advocacy summits are amazing. So far, we have 6 priority cities, which include Cleveland, Kansas City, Philadelphia, Dallas, Texas, New Orleans, and Atlanta. And so we'll be doing justice and advocacy summits all throughout the year. You'll hear more about that later. I've already pitched an idea for a video series. The video series, which is separate from this, is actually a great opportunity again for, there are going to be maybe 5 or 6 videos produced through our HRC media team. And what we do is there will be smaller organizations or smaller trans and non-binary entities across the country And you all will have an opportunity, we'll have an opportunity to talk. We kind of call it Oprah style. And you'll be able to tell us about the work that you do and really promote your organization and your work in whatever community you're in. One of the biggest things I think will be, it's going to be a great opportunity for you to market yourself and also promote the ideas of HRC and equality for trans and non-binary communities. We have our Elevate Fellowship, which is now going into its second year. Yay! Thank you so much for spearheading this, Jay Maurice. Elevate is a fellowship, and we actually have one of the graduates as an attendee right now. Elevate has been absolutely amazing. Trans and non-binary folks came to our HRC headquarters last year, and it is a program where they learn more about working in and for trans communities, and they have created this amazing family. They continue to learn through mentorship program, and they all are doing amazing work in their respective communities. And Elevate, all of the fellows is what they're called, even though they're ladies and a non-binary person. They all came from HRC's POA states. There are 6 states throughout the Deep South that are priority states for HRC. So we're looking forward to continuing the Elevate program. We have an Activate program, which is in its inaugural year. Activate is also part of the Transgender Justice Initiative. And Activate, you all will hear much more about this later as we push marketing down your throat. It's going to be open to trans and non-binary folks from all across the country. We're going to assemble 10 leaders, trans folks and non-binary folks who are already doing the work, and we're going to elevate your work through the Activate program. We're going to bring you together to learn more about communication, to learn effective ways to interact with funders and all kinds of other things. So you all will be hearing more about that later. That's Activate. HRC and our Transgender Justice Initiative has already signed on to be a partner with the National Transvisibility Virtual March this year. So we're going to be working directly with Marissa and the entire team to ensure that trans folks, our first project is working on voters' rights and getting out the vote, and you'll be hearing more about that. And also we have a very, very small pot of money because we do this year, but HRC and our Transgender Justice Initiative will also offer just a few scholarships for different programs throughout the year. So you all will feel free to contact myself as that goes on, and you will hear more about it. And now, next slide, please. I'm going to get through all my stuff so the other folks can talk because they have all of the good stuff. I'm going to sit back and look cute and listen. So according to one recent international analysis, transgender women have 49 times the odds of having HIV compared to the general population. All of this information is coming directly from HRC's website. I encourage you, check out our website, use the search engine. Just about any topic that you can think of is going to be there. We have amazing resources that would be wonderful for you and the work that you're doing. It can help promote your work and ultimately help our communities. There's also some introductory COVID-19 toolboxes and information there as well for you. So while transgender men are less likely to be HIV positive than transgender women, their rates of infection are still higher than that of the general population. Next slide. The Centers for Disease Control and Prevention, or the CDC, suggests that certain risk factors directly tied to transphobia and the marginalization that transgender people face that contribute to such high infection rates. And today, our panelists are going to discuss more about what that marginalization looks like, those many, many layers of things that really affect trans folks and how we are at such greater risk and impacted so much more by HIV. So, trans folks are living in a society where significant stigma and discrimination against transgender people exists. They're pushed into situations that greatly increase their risk for HIV their risk for HIV, and severely limit their ability to obtain adequate care. You all will hear more about the care side of an HIV diagnosis, and also what it looks like for a person, a trans person, a non-binary person, all the steps, all the additional tools that can help to keep us from being diagnosed with HIV as well. So HIV is more than 3 times more prevalent among Black trans women than among white or Latina trans women. That's a startling statistic. Next slide. So 1 in 3 trans people surveyed in DC are HIV positive. 44% of trans people surveyed in DC listed access to trans-sensitive healthcare as one of their top 4 priorities. 19% of trans people surveyed have been refused medical care simply because of their gender identity. And 28% have been harassed in a doctor's office. Next slide. Transgender people were also much more likely to be HIV positive if they had been sexually assaulted because of their gender identity. They were more likely to be HIV positive if they didn't have a high school diploma. More likely to be diagnosed with HIV if they had incomes below $10,000 a year. They were more likely to become HIV positive if they were unemployed or had lost a job due to bias. Next slide. And now to our panelists. So what we're going to do is each of our panelists is going to take 1 to 2 minutes to introduce themselves, talk a little bit about their work, and then I'm going to ask a few questions and we're just going to get into it. So first up, we have Ms. Carmarian D. Anderson. Carmarian.
Thank you so much, Tori. And I will say good afternoon to everyone. It's so great to be included with these prestige individuals that is serving as the panelists. I know each of you personally and work with you throughout the years and the work, so I love you very much. So my name is Carmarian D. Anderson. I am honored to be the state director for Alabama. I serve in the initiative called Project One America, which is an incredible opportunity for Southern states to get involved with HRC. I would like to say in a history making and how I know HRC is moving to its next dimension, I was honored to be the first trans person of color. I'm black people, I'm black, you can see it with blush. But to be hired in a leadership role with HRC, which at one point was a heavy weight. And I'm so honored now that Tori has joined HRC, doing some amazing work to focus particularly on our trans-identified community. Project One America in the state that we serve is Arkansas, Mississippi, Alabama, and Texas. And the reason for the Project One America initiative through HRC is because we found that there was no statewide initiatives in these southern states, few current protections. And so we tried to increase the municipal equality index, our hospital equality index, our corporate equality index, because we have terrible climate for our LGBTQ community in those 4 states. It is a blueprint, and so we're not ignoring the other southern states, but it does give us an opportunity to really make a difference in those states that have to be educated, that we don't have to accept the short end of the stick any longer, and that we must show up to be counted. In addition to this work, we do this work through institutional change, legal and policy change, through our lived experience as LGBTQ people, and through cultural change. I will say the importance of this initiative, and also partnering with TJI of HRC and Tori Cooper, is we have an opportunity to really focus on the intersectionalities of our climate here in Alabama, particularly in my other Project One America states. It's very important for trans-identified people in this moment, especially when we're speaking about health disparities. As someone who left public health, managing certain programs for HIV and health equity and epidemiology, I can tell you the statistics are very, very high for our community still getting contracted and being affected by HIV and other communicable diseases. So this conversation is so important. Couple things that I will say in the short period of time is that we still need more funding. And so without that funding, then therefore we will become the mold, as I always will say, we will be ignored, and HIV rates will not decrease, but they will increase, because when you ignore a population for so long, we are still human, we still want love, we still enjoy sex. So come on, somebody. I feel like I'm having a church moment. But at the same time, it's important. There's been some fantastic work that Tori Cooper, myself, and Tatiana, and most of you have done throughout the United States. There are evidence-based interventions that are already written for trans-identified individuals. One is called TWIST, that Tatiana, myself, and Tori, and 2 other colleagues, we were fortunate to author with CDC. But I want to talk about the accountability of the importance. And although we're being ignored, it's important for us to show up. And so the accountability piece is called circle accountability, is that if there are opportunities for you to get tested, take advantage of the resources, then show up. It does no good for us to be on the front line advocating after the fact, when we have the opportunity now to show up, be counted, and be the community of the change we want to see in the world, and we want to reduce HIV rates. And so I am Carmarian D. Anderson, State Director for Alabama under the Project One America State, and I am honored to be included in this panel.
Yay. Thank you so very much, Carmarian. That's amazing. And I'm so excited about having an opportunity to continue to work and continue really to help our community in ways that we believe will be long lasting and really, really positive. So again, I want to welcome, I'm going to introduce our next speaker. I'll allow her to introduce herself. Ms. Zakia Mackenzie. She's going to take about 1 to 2 minutes to talk about herself and the work that she does.
Thank you, Tori. I am honored to be on this esteemed panel today and this monumental movement that we're doing. So thank you, Tori, for giving us this platform to talk, educate, and elevate our community. As Tori said, my name is Zakia Mackenzie. I'm from Richmond, Virginia. I've been in the field of HIV prevention and education for about 20 years, starting off in a nonprofit called Fan Free Clinic, which is now Health Brigade. I transitioned from working in the nonprofit sector into becoming a DIS for Richmond City Health District, where I was the first African-American trans woman to work in the health district as a disease intervention specialist. And after working in that field for about 6 years and hearing the needs of clients, the needs of why my sisters aren't coming into the health department, and the social health disparities for our community, I created this organization called Nationz Foundation. And Nationz Foundation provides free HIV and STI testing, a food pantry, supportive services to include a group for gender nonconforming individuals, trans men, trans women, and those individuals living with or affected by HIV. We have emergency housing, 2 mobile testing units, and we've just acquired a new home that we can provide emergency housing for trans individuals called the Aim to Inspire House. I'm excited to be here to have this conversation this afternoon, and I'm just looking forward to learning more and talking more and connecting with my people in the community that are doing amazing work. So thank you again, Tori, for allowing us to be here today. And I'm excited. Thank you.
Thank you, thank you. And I will forever personally be grateful to Zakia. She's talking about, she's thanking me for allowing her to be the first, on the first panel of TransTalks. But Zakia is actually the very first person that encouraged me to talk and use my voice in the work that I do now full time. So I am forever in debt to you. I appreciate you and I love you.
And I love you, and I'm so proud of you and everything that you're doing and all that you have accomplished and all that God has in store for you in the future. So
thank you. And make sure, and each of you, thank you, that actually brought up another point. I want to make sure that at some point during this session, and now wouldn't be a bad idea, for each of you to type your organization, a link to your organizations, put it in the chat box. I know Zakia is raising some money now for the Nation's House. So all of these things, all of your organizations, panelists, make sure to put that in the chat box at some point, because we want folks to support you all in the work that you're doing. That's another reason why we're doing this. So next up is someone who I absolutely adore, Freddie. Freddie, tell the folks about who you are and what you do and where you do it.
Hey, Tori. Well, I first want to thank you for having me on this panel with such amazing people. I feel so honored to be here today. My name is Fredy Roberts-Ramirez. I use they and them pronouns, sometimes she and her. I'm the TGNC HIV Prevention Program Manager, also known as the Voices Project at Howard Brown Health at the Broadway Youth Center. We're federally funded by the CDC, or PS 17-1704, to be able to provide services, create safe spaces and things for TGNC people of color and their partners from the ages of 12 to 29. I don't know if you guys know a little bit about Chicago, but in Chicago, the South and West sides are resource deserts. For most people, there's not really a lot of resources in Chicago, and especially for trans and gender nonconforming people. So we had opened up a safe space on the South side of Chicago. We're about to go into our second year of it being open. It's called Triple S, which is Southside Safe Space, where we are open Tuesdays and Thursdays for now, just signed a lease to be open full time. We're just taking over the space. And we see about 40 to 50 young TGNC folks on the days that we're open, where they can come and they can receive HIV testing, resources, linkage to housing, government benefits, and things like that. Also, like through this program, I was able to secure extra funding outside of the CDC funds to be able to hire 15 young TGNC folks and put them through leadership development, so that way they can be the next upcoming leaders of the future, and teach them to do the work that we're doing and be able to succeed and keep doing all the work that we're doing and move and push it forward. Tori, thank you for having me here. I know you said 1 to 2 minutes, but I could keep on talking, but I'll just pass it back to you.
Thank you so much, Freddie, and just continue to grow, because So I'm so proud of you, and all of the folks that are working under you. I'm not going to start mentioning names, but you know what I'm talking about, T. I am so amazed at the influence that you have over young people, because I'll be 50 in about 33 days. So I don't know if I could be considered young anymore. So I am amazed at how you are influencing their lives. Thank you. Thank you. So next up, Tasaki. Come on, girl.
Hello, everybody. I am Jasmine Sasaki. I'm the founder and executive director of WeCareTn in Memphis, Tennessee. A little background on me: I have been in the community, in my community, since 1996. I'm 37 years old. I started out doing community work as a gay parent and as a pageant figure. And I went through a lot of trials and tribulations that brought me to a point of volunteering to do some advocacy. And from that point, I went on to actually begin a career in PrEP navigation. So I worked in PrEP navigation and HIV testing and counseling for about 2 years. I then transitioned to the National Urban League of Young Professionals, where I was the first trans person in the history of the organization to be a leader in the 108-year existence. I was the health literacy and advocacy chair in that respect. After a year of working there, I transitioned out of nonprofit altogether to take a break and really assess what I wanted to do different. And then I founded WeCareTn. WeCareTn is an organization that addresses HIV prevention and treatment through the social determinants of health. We do not do testing. We do PrEP referrals. We do treatment referrals. But all of our programs address homelessness. Our programs address harm reduction. Our programs address job readiness, employment. So all the things that can make you vulnerable to contracting HIV. We also were the first in the state to do something of that sort. We have actively employed 7 Black trans women who are drug users and sex workers, and we're giving them an opportunity to be developed on site. We do leadership development for our staff, Everyone works in partnership. So for every position, there is another person that works alongside of you, and you all have the opportunity to move up in the organization or remain where you are, whatever you see fit for yourself. So basically, we are doing the work that is not often done in Memphis, Tennessee. We are doing syringe exchange programs. We are even focusing on hormone needles more so than just needles that people use to shoot drugs, because we want to make sure that our community is centered. We are also doing job readiness programs and programs that pay. My programs pay $1,000 and $500, and they leave with something that they can work with. We do group and individual counseling sessions. We have 2 therapists, and we have actually transitioned everything to the virtual world. So we are seeing what that looks like. But yeah, we are just up and running, and I'm representing the trans women who are the underdog, who has been in this community for 20 plus years, but may not have done the work in office, but has been doing the work in the community. I'm also representing those ladies who have never been given an opportunity to evolve in the organizations that they work at. I think that my main focus is helping trans women take our voices back, and also helping us to formulate what the work looks like. Also understanding that we are inherently organizers, and we don't need white people or cis people to validate who we are and what we know how to do. Also in representing the community of older trans women who really are happy to see the opportunities provided to the young trans women, but I want to bring an intergenerational approach or strategy in working through what it looks like to be a leader in this community. I'm also representing those people that's not taking any bullshit from funders. I'm writing my own grants, whether they're right or wrong. After a while, I know that they will be what they need to be, but they will always represent me, my community, and what we go through. Once again, I'm Jasmine Sasaki, WeCareTn, Tennessee, in Memphis, Tennessee.
That's why you won Miss Westland, exactly because of that. Wow, okay. Child, I will get up and run, except I don't have on panties. So that'll be a whole different webcast for later. I'll charge for that one. But that was phenomenal. Thank you so much, WeCare Tennessee. Thank you, Jasmine. So girl, I'm so proud of you. I'm so proud of you. All right, so next up, the Latin bombshell herself, Maria Roman Taylorson.
Hi, everybody. Wow, what an honor to be part of this panel. I want to thank you, Tori, one, for including us, to be part of such an esteemed group of amazing leaders from across the country. It's humbling for me. I know that we are at this time all in uncertain times that are scary for community. I would like to introduce myself. I am Maria Roman from Puerto Rico. I live in Los Angeles. I am fortunate and privileged to be the Vice President and Chief Operations Officer for the TransLatin Coalition. I'll say it again, Vice President and Chief Operations Officer. Who would have thought that I would have a title like that one day? I myself also come from the streets. I know what it's like to be a homeless trans youth, and what that feels like to not have access to services. That has been sort of the fuel that has led me in the path to be today in a place where I can be in a panel with other amazing people that are doing amazing work across the US. So the TransLatin Coalition continues to have our doors open here in Los Angeles. We're taking every precaution to make sure that both staff and clients are safe. We are using all the tools that we have available, from telehealth and other ways to communicate, to make sure that we are connected to our community. But now that I have this opportunity to sort of speak, I would like to sort of address some issues. I know today we're celebrating National HIV Testing Day, but the truth is that when we talk about that in the future for trans people, I firmly believe that the future for for our people is trans-led. And what I mean by that is to really invest in the trans community, trans-led organizations. And the truth is that if you look at many organizations across the nation that are trans-led, they do not have the infrastructure to really be able to do HIV testing. I think that has to sort of be the first step in order to have a place where trans people feel comfortable to go and get tested. The truth is that today, many places across the country are closed, are not accessible for trans people to get tested. Many places are insensitive to our community. So that's one of the first things I think we need to really start focusing on, and really creating, investing in the development of the infrastructure for trans-led organizations to be able to sort of take the leadership role when it comes to providing HIV testing. I also want to highlight a report that was recently brought out from funders for LGBTQ issues that talked about sort of LGBTQ specific funding. In this report, it highlighted that out of $100, 4 cents are invested in trans-specific issues. Out of every $100, 4 cents. We as an organization have written a letter to philanthropy, because this is really just not acceptable. We are asking, and you can go to our social media, to our website, to sort of sign on and be part of this efforts to let the philanthropy world that we need a commitment of at least of every money that is coming to fund LGBT efforts, that 20% of that fund goes to fund trans-specific issues, and I hope that everybody, I mean, I can talk and talk and talk, so I know that we have to be respectful to the 2 minute, but I think as trans people, we need to sort of take ownership of our lives, of our programming, and I firmly believe in my heart that our future is trans-led. And that's why it's such an honor for me to be here with everybody in this panel. Please take care of yourself. Anything you could do to make sure you're healthy, do it. Because the truth is that there's so many people out there rooting for us to get sick. You have to do everything you can to keep yourself healthy. I love you all, and thank you. Enjoy your Saturday. I'm happy to be here. God bless you. That's all I got.
Girl, that's not all you got, but thank you so much for that. And that's really interesting, that 4 cents out of every $100. You all can find that information. One of the websites where it is funders, the FCAA.org, I believe it is, Funders Concerned About AIDS. They have an amazing enterprise that operates out of the Kennedy Center in New York. It's startling how little resources of all the LGBTQ money and all the philanthropy in the entire world, how very little of it goes to trans work in trans communities. So thank you for that. I would like to let's have Alfonso come up next, my baby.
Absolutely. Good afternoon, everybody. First off, what an honor it is to be among so many powerhouses in this community that are doing some phenomenal, life-changing work. So Tori, I want to say thank you, sis. Thank you to the Human Rights Campaign for even sponsoring an event like this. This is so needed. So as you said, Tori, my name is Alfonzo Mills, not to be confused with Alfonso David, although I would take that as a huge compliment. But I am a two-spirit person living here in Atlanta, Georgia. And I have been living with HIV for almost 8 years now. And while that has been quite the journey, it has brought me to this very moment now to where I'm working with a AIDS service organization right here in Atlanta, Georgia, Positive Impact Health Centers. We have 3 locations in Decatur, Marietta, and Duluth, where we offer PrEP, we offer HIV testing, STI treatment, housing resources, case management, substance abuse counseling, behavioral health counseling, and we just acquired pharmacy. So we're really trying to be a one-stop shop, which is extremely important on a day like National Transgender HIV Testing Day, because we make it a big part of our mission to really reach the community, one, where they're at, and two, reach them and not just leave them there. So we're really doing our best to bring people to us, but also going out to where the people are so that we can get the services there and get the people the services that they need. So on top of all of that, I'm also a minister at Vision Cathedral of Atlanta here in Atlanta, Georgia. I also am a patient ambassador with snow companies. So pretty much what that involves is just me kind of going around using my story to empower and enlighten people about the truths about living with HIV, letting people know that, you know, you can still have your whole life, do what you want to do, achieve everything that you wanted to accomplish before your status living with HIV. So, and I think it's important to bring all of those things to the forefront: gender identity, spirituality, public speaking, all of that, because HIV has no face. HIV doesn't matter what your background is. Everybody needs to be educated. Everybody should be tested. And everybody needs a little bit of empowerment, especially our trans community. One, because y'all are a gift. I love y'all. Without trans women, I wouldn't be able to express myself the way that I'm able to now. And I thank each of you. I've met a couple of the panelists, and y'all have inspired me beyond measure. So again, it's an honor to be here. I thank you all for joining us. It is truly an honor and a pleasure. I thank you all.
Thank you so much, Alfonso. And a little later, I'm going to ask you to tell folks what Two-Spirit is from your perspective. But I do have a quick question. Somebody might be wondering why you look so familiar right now. Like somebody they may have seen before.
So, so I may have a familiar face. You may have seen me on a commercial for an HIV regimen. So if you happen to notice the locks, that, you know, you may have seen it in a little bun or something like that. That was me. That was me. So I appreciate that shout out, Boo. Thank you.
Oh, I got you. Thank you so very, very much. Right. So thank you so very much. So there's a really handsome guy sitting next to you.
Ain't he handsome?
He could get it. So would he please, his name is Jamel. Would you tell us a little bit about who you are, Jamel?
Good afternoon, everyone. How are you doing? And thank you.
Little louder, please.
Oh, a little louder? A little louder?
Mm-hmm.
How's that?
No.
Is that better?
No.
No.
Can you come a little closer?
How's that?
Much better.
That's much better. The microphone's in this one. Okay. Good afternoon, everybody. Thank you, Tori, so much for having me here today. It's an honor. My name is Jamel Ashely. I am a trans man who was born HIV positive. I have been an activist in the HIV in my entire life. I started public speaking at the age of 7 years old with an organization called Camp Heartland. I have been all over the nation telling my story since a child, because one thing that was evident to me from the very beginning is that no matter how you contract HIV, there is so much stigma surrounded around it. And I saw that as a kid, and I see it as an adult, and I believe that it is my mission and my purpose to make sure that people understand that living with HIV is not a death sentence, it's not a curse, and it does not mean that you're a bad person. On top of that, I also am the Vice President of Transgender of Excellence. I have had the honor of holding that position for the past year. TGE is an organization that looks at the trans man holistically. Our motto is we are more than our transition. So we work with people to better, to improve their character and their career, to assist with their financial life, with their health, and particularly with connecting them to organizations that do HIV testing. One thing that we do know is that trans men are underreported, and when it comes to knowing whether or not they're HIV positive, they're either reported as MSM with no gender identity, or they are reported as women. So one thing is very important for trans men to take care of our health. There's a lot of stigma around our sexual orientation and the activities that we may participate in. So that has been my charge for the past couple of years, is to make sure that my brothers know that they are valuable, know that their lives are worthy, and to make sure that they get tested and are taking care of themselves. Again, I'm Jamel Ashely, and Tori, thank you so much for having me.
Thank you so much. I appreciate you. And so I introduced the term to many of the folks at HRC. For people who are born with HIV, one of the newer terms that we're hearing is vertical transmission, correct? So if you all hear me talking about that, then that's what we're referring to. I think that's a very, very respectful way to say it. So thank you so much. I appreciate what you two as a couple.
Yes.
Because I saw y'all hugged up, so I figured somebody else was going to say so. I already knew, but I figured somebody was going to notice that you keep feeling on each other. Well, discussion.
Picked up on it.
Just allow ourselves to call it what it is and keep it moving. Thank you
We're gonna be
very much. Last but certainly not least, it's my girl, my chick, my homie, my sister. Girl, come on before I start crying.
Good afternoon, everyone. I am so honored to be with you all today. Tori, thank you so much for this amazing invitation to be amongst family, sisters, friends, loved ones, siblings. My name is Tatyana Moaton, and I am a senior capacity building specialist with San Francisco Community Health Center. I humbly serve in that role. And as Carmarian alluded to earlier, I am honored to be amongst some amazing women, Tori Cooper, Carmarian D. Anderson, Octavia Spencer, I'm sorry, Octavia Louise, Marissa Miller, my sister who is here, Neve Anderson, to develop the first intervention ever developed specifically for trans women living with HIV. So to be amongst those women, to be a part of that initiative, and for the CDC to prioritize the needs of the transgender community in that way was very intentional. As I said, through my work, I am also a CEO of Envision Consulting, which is a Black trans-led and focused consulting firm in the country that focuses and centers the work of transgender individuals being involved in the work. Like I said, I work for San Francisco Community Health, and through San Francisco Community Health, they have an amazing program called Trans Thrive, which stands for Transgender Resource and Neighborhood Space and Transgender Health and Resource Initiative for Vital Empowerment, was the new incarnation of the transgender drop-in started by UCFS and transferred to the Asian and Pacific Islander Wellness Center. I'm also proud to be a licensed missionary at Powerhouse Church of Chicago, which is a part of Powerhouse Global Network, where I am under the direction of my amazing apostle, Keith McQueen. And we are very, very intentional. We are an affirming ministry, but we are very intentional about centering and putting trans people and those most marginalized at the front of ministry, bringing them back into the church and letting them know that they are a part of God's family. You are valued. You are loved. We will protect you. We will stand with you. We will stand in front of you. So and as you see, the passion is coming out in my voice as I begin to talk about that. But I've been under the direction of my amazing apostle who has pushed me to the forefront of ministry. And just, it has amazed me how some of the things and historical and institutional traumas that have been experienced by my community in institutions of religion, and they kind of veil it in that way. So I'm amazed and honored to be serving under an amazing apostle. But like I said, I'm grateful to be here. I'm a very humble person, so I won't take up too much time, but I am just, as you all know, and will learn, I am here to serve my community. I live my life by a mantra daily that says, I will continue to fight because I know one day I will encounter someone who is not strong enough to fight the battles that I may have always won. So I am a perpetual servant of my community. And thank you so much again, Tori, for this amazing opportunity.
Thank you. Thank you, thank you, thank you. So That was amazing. And you see, there's a lot of power on this call. So that's why you all are here today. This was ordained, and I appreciate you. So we're going to go right into it. We're going to do some rapid fire questions for folks who are for non-panelists. I encourage you to write any questions that you have in the chat box. We have Dimitri and Keo who are monitoring the chat box, and they're texting me and making sure that I see something if I don't see it. But we have a few questions. So what I'm going to do is we'll get probably one of you to respond to each question, unless somebody has something that's just burning on their tongue that they have to add. We're going to go on to the next question because I want to give everybody an opportunity to have their voices heard and their opinions heard as well. So Maria, tell us a little bit about the social determinants of health. And we're going to try and do 1 to 2 minutes for each of these questions so we can get as many of them in as we can. And I know that's hard.
Yes. You know, the social determinant of health are all those things that really put individuals at risk for any sort of health condition when it comes to having access to having a place to live, food, employment, where they live, what they're exposed to. And traditionally, we've seen for over 20 years have been in the HIV field that those things really have not been addressed for trans community. We've seen that ongoingly, people have had to go to programming that dealt with leadership and making people feel good about who they were, yet they had to leave that intervention and that program and that center to go and face the homelessness that they were still facing. And I think until we address those social determinants of health, it's hard to sort of change the way people are prioritizing HIV testing or protecting themselves. If somebody does not have a safe place to live, food at their table, or feel safe, the last thing on their mind is going to be, wow, I need to go get an HIV test. Especially today, we know that under this pandemic, we as a people are not really being included when we're thinking of, when the system is thinking about how we keep people safe. We have to sort of fight for that, and including, you know, many other organizations that are currently open, you know, do they have access to masks and sanitizers and gloves? You know, people who are disabled, people who are elderly, who might be sick. There's many community members today that might be sick with COVID-19 that don't have a family member or somebody that can sort of come and drop off some food, come up and drop off some tea, medicine, home remedies to sort of soothe however symptoms they're feeling. So those are all the social determinants of health that really put us at risk for poor health outcomes. That's what I define as sort of social determinants of health.
Thank you so much, Maria. So what I'm hearing is the social determinants of health are all of those things that people need to live and survive and breathe and all those other things. I think that's so important. And as trans and non-binary folks and two-spirit folks, we know that we are communities that are really, really left behind. And we're going to talk more about that. So my next question is actually going to go to Tasaki. Tasaki, my question for you is, all right, so let's say a person comes in and they get a positive, reactive test result. Now what? But I also want you, and I'm only giving you 1 or 2 minutes, but I also want to know, a person comes in and they get a trans person comes in and they get a negative test result. Now what?
Well, you know what, the first thing I want to do is lift up, when we're talking about social determinants of health, it's important that we take into consideration where we're located, because that makes you very vulnerable to the disease. So here in, to HIV. But in Memphis, so if a transgender person gets a positive result or a negative result, unfortunately, it's pretty much the same thing, right? It's just an explanation of the result and it ends there. And I don't think that there is someone or there is a method put in place to kind of close the container for trans people because there's so much stigma associated with us. I think that specifically here in Memphis, a lot of the testers and a lot of the counselors are more familiar with giving results to cisgender people or MSMs, right? And sometimes how a transgender person looks to that particular person can change the way they deliver the experience, right? And that experience is one that we as trans people already have apprehension towards. I think that it's still very hard for trans people to go and even get an HIV test somewhere like Memphis, Tennessee, where we are largely impacted by HIV, where our Blackness is not supported in totality. We live in the Bible Belt, and here, you know, the Black community does not support all aspects of the Black community, specifically when it comes to trans people. So I think that for trans people to get a positive or a negative result, unfortunately, nothing happens. It's up to trans people to navigate how they're going to move forward. And if they want to move forward, it's also up to trans people to try to unpack some of that stigma that comes along with a negative result or a positive result. We're in a time right now where a lot of trans people who are HIV negative really feel unsupported. And I think that a part of prevention means supporting them and also just like uplifting that we do not support sex workers, we do not support drug users, and we don't support trans people. And we know that Black trans women, speaking from personal experience, we are vulnerable to all of that, right? So we're left with nothing when we get a positive or a negative result.
Thank you so much, Jasmine. With that being said, Zakia, I know you have Nationz Tasaki, Jasmine, excuse me, is WeCareTn in Memphis. Zakia is Nationz Foundation in Richmond, Virginia. So Zakia, I'm gonna pose the same question to you. I'm a Black trans woman who comes from Church Hill in Richmond, Virginia, and I come in and I take a test, but I'm negative. Or I'm a trans woman and I come from, what is it called? The Upper West End. I come in and I test positive. And now what?
So if you are a Black trans woman and you're coming in from Church Hill and you're testing negative, then I'm still gonna talk to you about PrEP, explain that information and how that is helpful to you. We're gonna, if that is something that you're interested in, we're gonna connect you to those services. I'm also going to talk to you about our new program, Transcend, that is sponsored both by Gilead Pharmaceuticals and the Virginia Department of Health, and explain to you about that program and how that program can just help a sister out by providing access to our food pantry and fresh food items, how it has rental assistance, how it has just assistance for unique needs of trans women, whether that is needle exchange for your hormone replacement needles. It's also teaching them financial literacy and job readiness and connecting them to different services. If that client is, on the other hand, positive and from the far West End, that doesn't matter to me where she comes from. It's the fact that she's trans is what's important. And then we're gonna link her to care. So we're gonna get her to fill out the CCSA forms that we need to link her to a medical provider if she is ready for that. Offer her supportive services that includes the food pantry, do an intake with her to check out her financial stability, her living situation. Is she a survivor of domestic violence, or is that something that she's dealing with? And then we're gonna connect her to those services and follow through. The difference in Virginia is that I have been in this work for 20 years, and for 20 years I have advocated for these services, and you know, I'm thankful to God for leadership and connecting me with people to build relationships. We were able to make huge strides in Virginia for the trans community. And this year, I'm even more excited because our General Assembly, our governing body, was Democratic. So celebrating this year, we had birth certificate bills, and we had the Virginia Values Act accomplished thanks to the work of HRC. And, you know, we've had so many strides, even transitional services being included in our health insurance carriers in Virginia. So things are changing, and they know that those social determinants of health are reasons why people are becoming more infected. If we don't have jobs, if we don't have housing, if we don't have access to those services that we need, then HIV healthcare, medical healthcare is not a priority. Our priority is eating and living. So to see change here in Virginia is amazing, but that is what I would do with those individuals. Either way, I would connect them to care or connect them to preventive services.
Thank you. And again, you see why she kills Q&A, because aren't you a former...
Black America and the current reigning sweetheart.
Thank you. So that brings me to you, Freddie. That brings me to you. So we know that there's not enough services for people who are new, who are involved or who are actively in HIV care systems, and certainly not enough for people who are new to HIV care systems. But if I'm from the south side of Chicago, like, I was about to say a name, but if I'm from the south side of Chicago and I come in and I test negative, but I need some resources, and I just want to know, does PrEP work?
Well, that's what I would tell them, because that's what the CDC tells us. I would recommend PrEP, that it works as 99% effective if you take it properly. You need to have it in your body for 7 days at least, and then you got to keep continually taking it as long as you're promiscuous, I feel. And if you want to, you can.
Hold on, your mic went out. So I want you to say the whole thing so nobody jumps in the chat and says you said some shit. Say the whole thing out that you just said again.
Oh, I just said that it's 99.9% effective as long as you take it for 7 days and it's in your system. You continuously take it while you're being promiscuous. I feel it does work for most people if it's for you.
Interesting. So is PrEP just for people who are promiscuous?
PrEP is for anybody who feels like they need it or if they feel that they are at risk for contracting HIV. It's for people who, if you feel like you don't like to use condoms, PrEP is always another tool in the toolbox for you to stay HIV negative. Yeah, I feel.
Okay, groovy. All right, good. I wanted to make sure to make that distinction, because I can be promiscuous and not use PrEP, or I can be promiscuous and take PrEP. If I get an STD, it's all over anyway.
I just say for people, like when I do consult people here in Chicago or talk to people, like I always offer PrEP to a lot of the young people, but a lot of young people don't want to go on PrEP because they just feel like the side effects and the things that are going on with it, it makes them feel funny. But then I also recommend condoms to them. A lot of the young people that I work with right now, or that come through through the programs that I work with, like PrEP is not the first option. It's not the first thing I'm going to offer them walking right through the door, when there's a whole bunch of other things that are on their back. We're like, where are they going to sleep tonight? Where are they going to eat tomorrow? Like, are they going to be safe leaving here to go home on the train at nighttime? Making sure that, are they going to be alive tomorrow? There's so many other determinants that are going on with these young people that I work with, that PrEP is not always the first thing I think about and want to shove down their throat when they have a million other things going on.
That's a great point. So since we got to PrEP through social determinants of health, are you and your team at Howard Brown Health in Chicago, are you all helping to address some of those issues even for people who don't test positive?
I think that with us in the Voices Project, we're always looking for other resources to try to help uplift the trans community. Since I have 5 other trans and gender nonconforming people on my team, like we've all been in situations like the young people that we work with. We've all been sex workers. We've all been out there homeless. We've all had to do stuff to survive, just survival mode. So we all know where they're coming from. And we are always looking for other ways to try to get people things, like in order to help them out. Just like with this whole COVID thing that's going on right now, people can't come to us, to our resource center, to come get resources. So we're doing mobile things like going to their houses and actually dropping off food and resources and gift cards for them to go grocery shopping, and face masks and gloves and things like that. So that way they can take care of themselves and the other 5 people they have living in their houses with them.
Awesome. Thank you so much. Thank you, thank you, thank you. Joy, I see you have a question in the Q&A. Could you put your question in the chat box, please? Because I want to make sure everybody can see it. You can just copy it in there. I couldn't do it myself. Thank you very much. So Maria, I have a question for you. I don't get it. Why don't people just take the test? Well, okay, so how about that? I'm going to break it down even further. Why don't all these Latin people just take the test?
The truth is that there's so many barriers why people don't get tested. I think over the years, we all know what's right and wrong, right? However, in between right and wrong, quote unquote, there's so many things that get in the way for all of us in decision, whether it's having proper access to a testing site, whether it's going to a testing site where you are treated with respect, where people speak your language, where you feel that you are sort of empowered and encouraged. And I think that a lot of the information that's disseminated amongst, I would say, particularly our community, Latino, is from one another, whether it's hormone treatment. Many Latin women have been self-administering hormones for the beginning of their transition. So they sort of rely on other individuals' encouragement or information. And if we hear time and time again that places that are available for us to get tested are not really sensitive. And I think the notion that every LGBTQ place that has been providing HIV testing for the last 20 years is sensitive to trans people, that is not true. That is not really factual. I think that there's a lot of places that are thought of as places that are LGBT friendly that trans people go to and have a horrible experience. So there's a lot of things that play into whether people make the decision to go get tested. The truth is that we still live in a society that has a lot of stigma if you are positive. It's a thing that for many people has been weaponized against one another. So sometimes not wanting to know the results it's a reason that would make you choose not to get tested. On the other hand, we see that a lot of trans people that see the services that people who are living with HIV have access to, we've seen people that, have contemplated that maybe they were HIV positive, they would have access to more resources. So there's a lot of information, misinformation, and it's an ongoing work that we have to do. That is why it's great that this panel addresses this, and we have to look at the larger issues too. Those are some of the issues.
Thank you so much for that, Maria. Which brings me to a question that I have specifically for Jamel. I am wondering why, if people don't get tested, that means they don't know their HIV status. But I still don't get it. Why wouldn't trans people want to know their HIV status? When I go I have posted pictures online. So y'all know I'm playing devil's advocate, right? So I have posted pictures online of me getting an HIV test and STD test. And I do it because, I don't know, somebody might see me do it and decide, okay, well, I guess I can do it too. And obviously I have to get permission from whoever it is that's testing me. But to me, it's an easy thing to do. However, I don't understand why, as a person who was assigned female at birth, that you won't take an HIV test, or at least want to know your results. I still don't get it. Or why, as a person who was assigned male at birth, why you just won't get the test?
Well, I think that's a great question, Tori. Actually, recently came across a conversation in a Facebook group where someone asked, would you date someone who's HIV positive? And overwhelmingly, the answer was maybe, no, I'm not really sure. I mean, I know it's not a death sentence, but, and so I think that plays a huge role in it, right? Like, people want to be loved. People want to have relationship, and they feel like if they take an HIV test and they find out they're HIV positive, then that takes away their ability to be a human being. Stigma is so heavy in our community. Stigma is heavy in the cis community, it's heavy in the trans community. So I really do believe that that plays one of the biggest roles in it, is people just not wanting to take the risk to be unlovable. I also believe it goes back to, you know, social determinants. Like, if I don't have a job or if I don't have some place to stay, I don't care if I'm HIV positive or not. And I want to speak more specifically to trans men. If you are a trans man that has sex with cisgendered men and you don't want people to know that, then you're not going to get an HIV test, because it comes, you feel like then your business is immediately going to be out there. There's this stigma about being a trans man, that about being a gay trans man. So there's so many layers of what's the word I'm looking for? Just of stigma. I'll just continue using that. There's so many layers of stigma that pile up on top of each other, right? We are fighting as trans people, one, to first love ourselves. So to put in a position where we may be unlovable to other people because we're HIV positive, that is a lot to take on. Our social determinants also plays a fact, and our sexual orientation plays a fact as well.
Tori, can I add to that?
Mm-hmm.
I think that I'm going to play devil's advocate somewhat as well. But first, I think that no matter who we are in this community, the culture of how we take care of each other, or each other's business, each other's personal business, but more so the culture of how HIV, the business, has created not only a space where they are perpetuating the negative stigma that comes along with our community, but also the people that are put into place from our community that work for organizations that do testing are very toxic. And these spaces are not parsed out in a way that we feel like we're cared about, right? So I definitely agree with what Jamel said, but I think that it's not just transgender women or not just transgender men, but it's the same thing all the way around. It's how we feel about, like when Jamel says, our business, right? So how we feel about the people who are doing the testing. So there's already like bad experiences around service providers, right? And then we've had peer navigators we put in place, PrEP navigators, community outreach people. And even the people who work in the community that are HIV positive are not comfortable enough to even share their status, sometimes with their own friends and family. And they're forced to work in a space where they are supposed to be, or we are supposed to be, the go-to people. So if there's no blueprint for people from the people that provide the test, there can never be a true resonation with testing from our community.
That's a good point, Tasaki. I appreciate that. And I'm coming to you next, Alfonso, because so Alfonso and I had worked for the same organization for a while before I left. What I'm hearing is something that we are often challenged with. It's difficult to give anybody a positive diagnosis. For years, I worked having to test folks. That was part of my job. But it's even more difficult if this is somebody that you have cocktails with.
Well, okay.
Or that you go to the club with, or you play cards with, because I like to gamble. So I am interested to hear from your perspective, Alfonso, what does culturally competent testing and care look like? And is it different for trans and non-binary people than for other folks?
So I'll start with the first part of your question. What does culturally competent care looks like? That looks like loving and caring for that entire person that walks into your agency, regardless of what they were doing 5 minutes ago, regardless of where they stayed last night, regardless of what clothes or presentation they may have. So culturally competent care is going to address all of those things, make that person feel like a whole person, and address every part of whatever their issues may be. So it's not about just giving that HIV test. It's about, okay, you said that you're having issues with housing. Let me put in a housing referral for you. Also, there is a really great support group that happens right down the street. They meet every Wednesday. I'll go with you next Wednesday if that's something that you want to do. So it's about addressing that entire person so that they can feel happy, and not just happy, but they can walk in the fullness of who they are. So bringing in people that are transgender or gender nonconforming, gender identity is a huge part of a way that somebody addresses how they take care of themselves. So if they don't feel like they're able to present their full selves, if they don't feel like they're able to be their full selves, especially when it comes to their healthcare, then I mean, the healthcare system is failing that individual. And that one failed transgender individual is a failed transgender community. Let's be real, because then that person not getting what they need. They're going back out to the community, and it's like, you know, that's how things just get mixed up. And we want to make sure that. As you know, at our agency, we are big about treating people the way that we would want to be treated, and giving people a life worth living. So I think it's extremely important that as you brought up, that people who are transgender and gender nonconforming receive care that's individual to their specific needs, their specific identity, and making sure that their specific needs are met.
Hey, Tori, can I just chime into that, please? Because when we speak about cultural competency, humility, responsiveness, and all of the wonderful inclusive words that we try to say and remove from this is a welcoming place, a brave space, we have to go back to the root. It is a cultural thing. Statistics shows that we as trans-identified individuals that are Black are at the highest risk of HIV, and then we have our brown siblings as well. And there's a cultural disconnect as it relates to institutional and community. So before I can show up, are you culturally prepared for me? You know, as a Black woman of trans experience or whatnot, it is much easier for me to understand that my health will be attended to if I can recognize a couple of cultural things in your agency. I can't, you know, the music don't sound right. You know, the person who's saying hello and misgendering me, you know, is basically not Black. And I'm not trying to make it from a racial standpoint, but how are we defining cultural reach versus just using this commercial culture, humility, and responsiveness to say that we're going to get a result? The other side of that is that as a Black community, and perhaps I will say maybe brown, but let me speak on my narrative. As Black community, especially in the South, we're not even reared with health wellness. That is not our narrative. We barely eat at the dinner table, the fried chicken and cornbread and, you know, sweet potato pies and all the Southern stuff, but we don't come together and talk about health. And so for those that are Black, and then when we transition, we are then ostracized out of our Black community. So what makes it our business to understand that anybody is going to attach to our culture when my own Black community don't even respect the skin tone of who I am, yet alone uses my orientation or my gender to bring at the forefront of them discriminating me. So therefore, now there is a mental or trauma blockage when we're talking about health. And then we can go on and speak about how we have to obtain income. And so there is also still a cultural reach for that. In my Blackness, we get the short end of the stick. As a trans woman, I'm still looked upon on getting 25 cents of a dollar, because when I show up, or you want to be a woman, with there, and therefore, since you drop your privilege, then now we have all of this in the bucket, in this blender, and yet we're still dying of HIV. And I think our responsibility is being intentional. I love looking at missions and vision statements, but if you're not living that out, and if it's not from a cultural lens, then therefore I may not show up. I may become silent, and I may have to go do what I have to do. And if that's affecting other people, then in my mentality, perhaps since I was ignored, then therefore I can be in position of ignoring others as well.
Thank you so much. Girl, I was ready to get a bucket for your collection. But what I did was, you all would notice my background image changed, and I wanted to specifically point this out because we're down to about our last 8 minutes. And I want to answer questions from our guests. And this is cultural humility, 3 principles of cultural humility. It's a lifelong commitment to learning and critical self-reflection. And what that means in part is if you're fucking up, change it. And every time you fuck up, change it. And when you're doing something right, critical reflection also means when you're doing something right, do more of it. Number 2 is a desire to fix power imbalances within provider, everything is backwards to me, within provider-client dynamics. And that's really, really important because there's always a dynamic in power. We're consistently fighting power and control. And when, depending on which side of any desk that you're on, there's a certain imbalance in power. And then number 3 is institutional accountability. Oh, Lord have mercy. We could just talk about that. And mutual respect, partnerships based on trust. And that trust is the big issue, particularly when it comes to institutions, because as trans and non-binary, hell, as Black and brown people, there's many of us don't have histories of trust with the institutions where we get care. So I thought that was really, really important. And you all will see that. I think it's just an amazing thing. And yes, you're right, Stacey. She is. Thank you. I responded to a text message. So thank you all for that. That was pretty amazing. So very quickly, I want to respond because I respect each of your time. We have about 6 minutes left. So I'm going to have Tatyana respond to this first question, and then there's a question, 2 or 3 questions specifically for Jamel. Jealous. So let's see. All right, so this is going to be an interesting question. Okay, here we go. So Tatyana is fluent in Spanish. I don't know if many of you know that. Just another one of her gifts. I don't know if she is Latinx, but I know she's proficient in Spanish. So I think this is a good question. And this comes from Lee Smith to the panelists. So as a healthcare provider that's attempting to offer compassionate, competent care to the same gender-loving community, how would I market to Black and Hispanic transgender? And I want you to respond to this question pretty quickly, Tati.
For sure. Thank you so much for that question, Lee. One of the first things that I would have to say is putting people in front of the people that they are treating or servicing. Oftentimes, and Maria kind of talked about this, and I think that it is time for us as trans individuals in the trans community to start holding these LGBTQ organizations accountable. Just because you are an LGBTQ organization does not mean that you do not have institutional racism, does not mean that you marginalize Black and brown, transgender, and gender nonconforming individuals. And for far too long, we have given these organizations a pass to profit off of our bodies, to profit off of our work, while being content to have trans and gender nonconforming people be in frontline positions, not positions of leadership, not decision-making positions. And like I said, getting back to the question, one of the ways that you will be able to effectively market to those communities is by putting people in front of the people that they are looking to care for or service. Because even myself, when going into healthcare organizations and having people who are cisgender, to be able to try to dictate to me what it is that my sex and my body and my healthcare looks like. And I can't really even have a conversation with someone who is coming and speaking to me from a heteronormative, because what it looks like for you is not what it's always going to look like for trans individuals, because the parts that I may use with my partner may not necessarily align with what you have kind of put into your head or kind of put it, conceptualized into this box, is that this is what everybody wants. Because not every transgender individual is homosexual. Not every trans person is heterosexual. And there are some trans people who love on other trans people, and that's okay. But if you're coming to me with a heteronormative and thinking that this is the way it's supposed to be, we will never fully connect. And although we are at talking about the National HIV and Testing Day for trans individuals, I think that it is important for us to talk about a lot of those things. Because when we talk about, and even earlier when Maria was talking about social determinants of health, we only have to look at COVID-19, the response to that, to outline the disparities that exist within healthcare. Trans people are not being talked about. Thank God I live in a city and a place where I could go and receive affirming healthcare so that I could get tested. But there was a time, and there are places that some of my siblings are on this webinar today, where that doesn't exist in their community. That's not the reality. They won't be affirmed. They'll be called sir or ma'am and all of these other things when going to seek out healthcare. So I think it is important for us to outline those disparities and, like I said, put people in front of the people who they are servicing. Don't go by and, fall into this kind of fail safe to say that, oh, I can't find trans people to put in these positions. And I call crap for people who say that. I hate to hear people that say that. And, and a lot of those other things. Invest in our community. Train those people.
Thank you. That's so powerful, so rich, so very, very rich. Jamel, and then what I want each of you to do is I want everybody to give us 30 seconds of something to leave on, because I'm respectful of people's time. So if you have to write a note to yourself, because I'm going to roll right out in the same order that we did our introductions, I'm going to roll with you all. But first, I want to address this question specifically to you, Jamel. And the question is from Tyree. It says, why isn't PrEP offered to trans men or even mentioned when trans men go to their doctor's appointments? And that's assuming that you have insurance to go to a doctor's appointment in the first place.
I think quickly to answer that question, I think that PrEP isn't offered to trans men because I think that it's assumed that most trans men are heterosexual and only date women. So I think that it's assumed that there's not a need for trans men to be offered PrEP.
So may I say, and so I like real words too. So is it possible that I can offer not just date, but have sex with? Because dating and having sex are two different things. And I like to make sure that people understand I can sleep with you and there's no risk for HIV. But if I have sex with you, suddenly there's risk. Those are two different things, Maria.
They are very much
sex
so.
with ain't the same thing, Zakia. Folks need to understand that. That's cute eyeshadow, by the way. All right.
So let me rephrase this then. I think it's assumed in the doctor's office that most trans men are still lesbians. That's how we are treated. Yes. That's how we treat it.
I wish I had somebody else's mic to drop, because I think that was it right there. That was it. All of a sudden, yeah, that was it. That was it. You just lesbians with a lot of hair on your face. So, all right. So 30 seconds from each of you, and then we're going to thank all of our folks. I see there are other questions. I promise you, Dimitri and Keo are responding to those questions. We can forward them to our panelists. You're right, Stacey. Alfonso didn't ever define two-spirit. Maybe Alfonso can add that in their closing 30.
I'll put that in my 30 seconds.
Fantastic. I appreciate it. All right. So, Zakia, no, girl, you up first. Give us 30 good seconds to close out on this.
So, love yourself, all of you, and wholeheartedly. You matter. You are strong, beautiful, transgender, and deserve respect. Your voice is important, and resilience and tenacity is in our DNA.
Thank you. Thank you. Freddie?
I just want to say that when it comes to HIV testing, most of us give money for providing these services in our organizations. Let's try to find more ways to help eliminate other barriers so that people can take care of their sexual health.
Come on, notes. That's great. Thank you so much. Tasaki?
I think I'm going to take my 30 seconds just to lift up that if you are someone that works for an organization, or you work for a healthcare provider, if you are a healthcare provider, if you work in nonprofit, unfortunately, if you have to ask how to market to our community, that means you shouldn't be doing this service. Until you can be informed by that community, then just putting people out in the front won't truly create a holistic program, right? So there will always be a part of their program that will have mistrust. There will always be a gap. And we as transgender people, gender nonconforming people, same gender loving people, when we are the ones who are put in place to be put in front of our community in order to market or in order to outreach, we have to take the responsibility to take a stand and bring other people in and create community advisory boards. Try to be intentional about talking to organizations about putting transgender people on their board. If people are not practicing meaningful involvement, then they're not doing anything. I don't care how much we go in front of people. It will never be what it needs to be until transgender people and same gender loving people are involved at every level of the administrative process and the service provision process.
Awesome. Thank you so much. Thank you so very, very much. Next up, Maria.
Hi, everybody. So I would say to really be vigilant about your health. We are in times of crisis. Many of us have lived through the HIV epidemic. I would say to many of us still continue to be not trusting of health departments. Just to be 100% honest, make sure you take care of your health and be innovative, you know, address the social determinants of health. Don't do the same stuff we've done for 20 years. If you're a trans person involved in an agency, speak up. It's time for us to demand more from people in leadership. It's time for us to not be content with just the basic entry-level health educator positions. We need to be in positions of power, or we need to create our own. So I think that there should be nothing for us without us at every level, from the development, the execution of any programming, and be loving and supportive to one another. Right now, more than ever, we need each other, because trust me, whatever planning is going on with COVID-19, we are not part of what they're thinking when it comes to planning. So we need to create and establish our own standards, our own approach. Yeah, thank you.
Thank you, that's rich. That's real rich. And we should be part of the evaluations as well. Because what I have learned is everybody doesn't speak the same language. I can write words down, but if you don't speak the same language, you might not understand what I just wrote. Oh, that was good. All right, in this order, Alfonso, Jamel, and Tatyana, and then I'm gonna have one last closing word and get us all out of here.
All right, so I'm gonna be real quick. 3 things, defining 2 spirits. So I think if you, God added a couple drops of masculinity, a couple drops of femininity, and just blended it all together. So baby, listen, when you get a little taste, you may get a little bit masculine, you may get a little feminine, you may get a little bit of both. But I think the freedom in 2 spirits is that you can be whichever one you want to be, whichever part of the spectrum you want to be, and that's the beautiful part about it. Secondly, I love my sister Jasmine saying that we need more blueprints. We need more people that are living in their truth. We need more people that are, if you are trans, baby, be trans fully, love yourself for it. If you're cisgender, recognize that you have a privilege. Love on your trans sisters and brothers. It takes the L, the G, the B, and the Q, all of us together, to love on our transgender family and our gender nonconforming family. We need it, we need it, we need it. Lastly, get tested, y'all. Please, please, please get tested. I just started an organization, Soul Model. It's about healing movement. Heal your soul during this time. We are all at home. If you're an essential worker, heal yourself, recognize that you are essential. Align your spirit, whatever you believe in, connect with it, because that is what's gonna get you through. And then reach your destiny. We are here for a purpose. I want each of us that's listening, each of us that this may touch, reach your destiny because you are here for a purpose.
Now, how am I supposed to follow that?
Oh, you got it.
My message, there is, as someone who'll be 32 this year and has lived with HIV my entire life, there is much life after HIV. No matter when or how you contract HIV, there is much life for you to live, but you cannot live that life unless you know your status. So get tested, get tested, get tested. Thank you for having me.
Thank you. I would have to say that point of phrase from a very prominent organization, our people, our problem. It is time for us to stop becoming so reliant upon these cis-led organizations for them to save us, for them to care for us, for them to even think about us. It is time for us to take back our own power. It is time for us to support our own. Stop tearing down people that are like you, like even when it comes to funding. And that's a whole nother dynamic because, of course, we understand that funders are in positions to pit us against each other. But it is time for us to take back and harness the amazing power that exists within our community if we are ever going to get anywhere. Because like you said, with those cultural humility principles, Tori, it is time for us to take some accountability. And although I have preached cultural humility and cultural humbleness and all of those other things, I think that it is time for us to change that narrative. We have to be culturally responsive because what care looks like for me here in Chicago will not translate to those in Atlanta. It won't translate to those in Memphis. And coming from a place of privilege and perspective, me thinking that that's the way it's going to be, it's not going to be that way. And so even when we get to the table, like I said, and I use this this quote all the time, Dr. Mae Jemison said, what's the purpose of fighting for a seat at the table is once you get there, you're going to behave like everybody else. If somebody isn't in the room and you have identified that, you are just as guilty as those people who invited you and you alone. Thank you.
So the word is complicit. If you put up with bullshit and allow bullshit, then you are complicit in bullshit. Thank you for that, Dr. Jemison. So I want to thank all of the guests. I want to thank all of the panelists. Thank you, Marianne, for stepping up at the last second and shouting out your program and all the wonderful work that you're doing. Thank all the folks at HRC.
Marianne too.
Ma'am.
You forgot Camarion.
Okay, so let's offer 30 seconds. She wasn't one of the panelists. That's why I didn't have her to close out at the ending. It wasn't being shady in there. But come here and give us 30 seconds to go.
I'll just switch to benediction. Let me just say this. The divine saw everything that was made good. And that's the trans-identified community. And it's important for us to know that we're not victims. We're not strangers. We're not sick. We're not confused. There was a resurrection so we can rise. So rise and get tested. Tell somebody to get tested. And if you already know your status, be sure you're taking your medication. Be well during this season because we are going to continue with life because we have new babies that we must still rear in their truth and be their example. Thank you, Tori.
Thank you. And thank you for reminding me, Freddie, and also Stacy. I appreciate that. I want to make sure that each of you posted your orgs and the work that you're doing in the chat box. So I looked at some of the names of the attendees who've been in and out of the room. Hire these people. All right. Consulting, capacity building, program development, evaluations, review, all that other kind of, just to have them talk and show up. Hire these people. All right. And what else? So, and then next month, so I think we're going to do this again next month. And next month, I think we're going to talk a bit about love. And relationships. So stay tuned for more information. Also keep in mind, we had about 40 people in the room. This will live on. So 40 people in the room now translates to probably potentially thousands of hits because this is going to be on HRC's website and it'll also be in other digital platforms and it's also going on our YouTube and Facebook channels. So I want to thank each of you for being here. Just because you saw 40 people at one time, there were folks going in and out of the room today, doesn't mean that's all that's going to watch this. So thank you all once again. I appreciate you. I appreciate Dimitri and Keo for your help with this. Have an amazing Saturday. We're going to talk soon, all of us. Any questions or comments, please feel free to reach out. Have an amazing day. And if you're in a place where you can get a test today, please go and do it.